and welcome to season 3 of the Qredible live broadcast. I can't believe this is our last episode of season 3, but we are quickly booking up season 4. Today we have Dr. Lisa Piper and Wendy Cohen-Osborne, co-founders of Code Health. We're so excited to have you guys. And of course, we have Brian Fitzpatrick, CEO of Qredible.
All right, and they promised not to team up on me today, so that's good. So welcome to the Qredible live broadcast. In a wellness market that is absolutely flooded with bold claims and rising skepticism, today's conversation is really, I think, going to cut through the noise. And we're going to focus on the data and verified transparency. And I'm joined by Dr. Lisa Piper and Wendy Cohen-Osborne, as Faith said. Now, they are the co-founders in Code Health. And I love this term. It's a bioenergetic wellness company that's really pioneering a gentler science-backed approach of healing using frequency-infused saline drops, and we're going to talk about what all that means. So, Dr. Piper and Wendy, welcome to the show.
Thank you. Thank you so much.
Yeah, it's so great. I've been really looking forward. Faith and I have really been looking forward to this episode. We've been talking a lot about it, and I understand that Code Health was really born out of a very personal health crisis for you, Dr. Piper, during the pandemic. And I always love the story behind the business, because what keeps entrepreneurs going is the why, right? It's the reason. It's the reason that gets you up and empowers you both every day. So could you share a little bit about that background and how how that has impacted you to help co-found this company?
Sure. Like many people, I got very sick with COVID, and I've never been so sick in my entire life. But I was very fortunate because my father happened to be a neighbor to a brilliant biologist who created what he coins resonant molecular signaling. And my father said, okay, if you get sick, give me a call. I've got these drops in my safe. And I'm like, Dad, I'm not doing chemical-based drugs. I'm not, doing all of the things that were suggested, because I just didn't trust what was going on. And so my dad said, he assured me, no, Dr. McMichael is like you, and it's natural and it works with your body and there's no chemicals in it. I said, okay, Dad, overnight me these drops. And so he did. And by the end of the first day, my fever that was 104 for a couple of days was gone. And by the end of the second day, I was starting to get the first signs of taste and smell coming back. It wasn't fully back yet, but it was miraculous. And fast forward a year. So point is his drops that came in a little glass bottle that looked like this with handwriting on it. It was kind of shady. And fast forward a year, I had different plans for my life. I was launching a whole nother program in my mind. And I went up to meet him. I went up to see my dad and meet Dr. McMichael. And I just said, Dad, bring me by to see him. I want to thank him for saving my life. And I want him to put a face with my name. And so I did. And then before I knew it, out of my mouth was, why doesn't everybody have this? And how can I help you bring it to the world? And he didn't know. I didn't know. He connected me with his business partners. And in that first call that I had with his business partners, I spent a majority of the call talking about Wendy. Wendy and I were very close friends. And because of her past business experience, there wouldn't have been anybody else that I felt strongly enough about that I could partner with and that could really do what needed to be done. And I just prayed that she would see my vision. And because she had her own experience with the product during the pandemic, she knew it worked. And she saw the vision. And here we are. We formed our company. And what we didn't know at the time was that Dr. McMichael had over 200 patents. And so we thought we were just coming to market with one antiviral formula that worked with COVID, but it worked with multiple other viral conditions as well. And so then we had to get very clear very quickly what we were going to launch the company with and what carrier we were going to use. We had to do some preliminary testing and really figure it out. And here we are. We formed the company and we
That is
figured it
awesome.
all out.
I love that story. I love that why, and what's really empowered you to start this with Wendy, because Wendy, your background's really in legal and healthcare, right? So you've done a lot in an amazing career through providing medication alternatives to medical providers in the past. So other than this close friendship and trust relationship that you have, what else really drew you to partner with this? Because I'm sure you had to stop and think, okay, startup, risk. What really drove you then to join Dr. Piper?
I think when I saw what these drops did and to really see where the world was at that time, and to know that we had something that was safe and non-toxic, drug-free, and simple to use, safe for everybody. And it's not dependent on size or weight. So here, the entire world was in a panic. They were being forced essentially to take the vaccination or to think that there was only one choice that they had. And this was a really bold move that we really had to decide, were we going to do this? We didn't know the pushback. We didn't know what was going to happen, but we just knew we had something special. And with what each of us came from, with our backgrounds and everything that we've each done individually, we knew that we were going to be together even stronger and better. So why not?
That's awesome. I just love it because you brought the best of your backgrounds to really create an amazing force. So it's such a powerful catalyst. And I really want to dive into what you created, because this is for our audience and even me hearing bioenergetic therapy. That's kind of a first time thing that for many people. So what is it exactly? What is bioenergetic therapy?
What we're doing is we're using subtle energy to influence the biology. That's what bioenergetic means. It's biology for bio, and then energetic is the energy that we're using to influence the biology. And the therapeutic is just what it is. It's a therapeutic. All of the products are saline solution that has been structured with very specific subtle energy patterns, which we call the code. And those subtle energy patterns are derived from the information in Dr. McMichael's molecular formulas. So, what we did was a little bit different. Um, if we would use his molecular formulas, it would require us to jump through a lot of hoops, FDA, a lot of cost, because there are ingredients. But what we do is we use quantum radionics, and I like to say it's like your cell phone. You have a cell phone and you want to capture some information. You take out your camera, you open it up, you capture the information. The technology stores the information as a digital image. Then you can take that digital image and you can put it on paper, canvas, coffee cup, anything nowadays. It's very similar, except that we don't use a cell phone. We use quantum radionics. That's the technology. The technology has the ability to map the energetic blueprint in the molecular formula. The technology then digitizes that information into the code. And then, because water, especially containing salt as a mineral, holds the information, it remembers. You've seen the work of Dr. Emoto or Dr. Gerald Pollack. These are brilliant people that have been able to prove by looking at water droplets under a microscope that water holds these vibrations or this vibrational information. And so the technology takes that digital code and imprints it into the saline solution, which simply acts as a carrier to deliver it to your body. So all the drops are delivered sublingual, one drop at a time, like Wendy said, regardless of size or weight. It's a microdose. We have found in our research that one drop usually is more effective than multiple drops, but people can take drops as needed and not have to worry about suppressing symptoms, because you're literally putting into the body what you're made out of. So you're simply signaling your cells to up or down regulate in order to restore balance in your body. Because if you're out of balance, that's why you're having a symptom. Your body is telling you, hey, something's out of whack here. And we don't force that chemical reaction like you would with a chemical toxin based, drug, over the counter prescription medications that essentially create other imbalances, which we call side effects. There's a host of side effects that come with it. We don't have that with ours because we're gently reminding your body what it was designed to do, and that's heal itself.
That to me is remarkable, and I have to say, it always makes me laugh when I see these pharmaceutical commercials, and they go on this long list of side effects, and I'm thinking, why would anybody want to take that? Right? It's like, oh, including death. It's like,
Unless it's an emergency. I mean,
and
now
they end it with an even possible death.
Yes, and that's like the amazing thing. So I do know that obviously there's a place for big pharma, and
of course.
but when it comes to getting your body to react as designed and treating your body to do what it's intended to do versus waiting for something bad to happen and then treating that bad thing that happened, there's a big difference. And that was what sort of opened my mind to these, looking after supplements. But when we talk about supplements, this kind of differs from the traditional supplements, because when someone takes a vitamin versus your frequency infused drops, there seems to be a difference. What's happening differently in the body versus, these supplements? And by the way, even like, you're talking about the one dose kind of thing, is I've seen a lot of supplements are going to depend on how much you weigh and all those types of things. But yet this is so natural and meant to react differently than the regular supplement. What's the difference?
The biggest difference is that supplements and chemicals that are in over-the-counter or prescription medication for that matter, all have ingredients and things that actually suppress the system to do what it should do. And what we're doing is we're just providing the information or the signal for the body to do what it's meant to do. So these chemicals, or, you spoke about vitamins, for example, even vitamins can be very dangerous and can cause side effects. And people think that just because things are natural, that they're okay for their body. But yet, if they're not taking the proper amount or even taking what their body should be, taking in, it can cause a lot of issues for that individual. So we call ourselves an alternative to over-the-counter and prescription medication, but it is really for everything. It is that true alternative for even supplements. And as we progress and as the company expands, we will expand into what we call our modern medicine cabinet or our code kit with everything beyond the 10 formulations that we already have.
Well, I mean, it's what's fascinating about this is that you're working with information and frequency rather than chemical compounds, which is totally different than the way the rest of the world thinks about, medicine and supplements. But it does kind of bring up the elephant in the room. And to me, the elephant in the room is the wellness industry's trust problem, right? And the supplement industry is essentially, at the end of the day, sort of self-regulated, right? I mean, we got Deshay and we've got all that, but specifically, products don't necessarily need FDA approval. They need sort of that oversight, if you will. But about 50% Americans, they really overestimate of how much the FDA actually regulates this sector, right? So consumers are increasingly, from what I hear, they're just overwhelmed with products that make claims without real testing or accountability. Now, this is very science-backed with 40 years of major research. So, the reason Qredible started, because we're all about moving from claims to clarity, right? It's about that transparency, trust. So how does Code Health approach transparency and verification?
Well, the first thing is that we do use one ingredient on the label, one ingredient. There's nothing else in the bottle. And we source our saline solution. It's medical grade saline solution that we source from Fisher Scientific, which is one of the top companies in the United States sourcing medical grade saline solution to hospitals, to labs, so we chose them. We also chose them because in the 40 years of research that Dr. McMichael has done on the molecular formulas, that's the base that he's used for his molecular formulas. So we've mirrored everything right down to protocols that he suggested. So that's the first thing. We do have a certificate of analysis on that. So while our product code is not FDA approved, the saline solution that is the one ingredient is. We have a certificate of analysis for that. So that's one thing. The next thing is the 40 years of research that Dr. McMichael has done. Many of these products have gone, his molecular formulas have gone up to phase 2 of their clinical trials for FDA approval. All we had to do was be able to show that the energized saline solution performed the same way that the molecular formulas did. And that was easy. And it's easy, not because there's anything else in the bottle other than energized saline solution. The problem is that the technology isn't available to show you that there's anything else in the bottle until you take it, put a drop under your tongue, and within that 15 to 30 minutes, you can see a physiological response. I will say the first thing we did was we used the BioWell gas discharge visualization device, which it's a biophotonic reader. Basically, it measures the light that you emit from your body. It does have an accessory that measures coherence in liquid. So we took all of our formulas, we took a baseline reading for, I think it was 14 minutes. We ran everything for the same amount of time, baseline saline, and then we compared it to our other formulas. All you can see is that in our code formulas, the water is more structured. It's more coherent. We can then further validate that by recent research that we commissioned the Emoto Institute in Japan to conduct for us. And what they did was they took a drop of, we did 2 products, Balance, which is our general cellular health formula, and Calm, which is our healthy mind formula. Take a droplet, they observe it upon freezing it under a microscope to see what the structure is. And our products formed a beautiful hexagonal crystalline structure, which is exactly what we were hoping, but we didn't know because one of the products we sent upregulates and the other one downregulates. So we didn't know what we were going to have on our hands. And we ended up with, all I can say is they're like these beautiful snowflake looking designs. And again, all this type of methodology does is it gives us a visual language to understand the quality of water beyond chemical analysis. Okay, so those were 2. We also did stress tests with the BioWell device, measuring a person's stress level before a drop of Calm. So we took the before, we administered 1 drop of Calm, we waited 15 minutes, and then we waited 30 minutes. And that's how I know that, and that's why I can say confidently that half the people have a shift in their stress level with Calm at that 15-minute mark, and the other half, it took the 30-minute mark before we saw a result. So somewhere between that 15 and 30 minutes is when people start to feel more grounded and present.
I'd settle for an hour.
And if it didn't bring the stress down, then you simply take another drop. And then we've done that too. So the other testing that we've done involves heart rate variability. And we did a whole testing on that. And all the results were very similar to the stress tests that we did with the BioWell device. We, even to the point of reducing biological age, your psycho-emotional state improves, your brain, the quality of your brain functioning improves, the way that you're using your energy reserves improves, because people don't realize you have energy, that is just part of making all your systems oscillate and work together. But then you also have energy reserves. And if your body is using too much energy to try to balance your stress level, then it's taking away from something else that it should be healing. And then that's why stress is the leading cause of dis-ease, because it's leading to a decline in your health. So that's why we're passionate about Calm, our healthy mind here. It's our healthy mind formula. It is our superhero because of that reason. And we also did live blood microscopy and EEG. So we've really hit it at all angles, and we see the same results over and over again. Another test we did was third party. So I saved the best for last because this was really exciting as well. We sent out React, which is our allergy formula, Balance, which is our daily general cellular health formula, and again, Calm, our healthy mind formula. We tested Dr. Hemal Patel of Versailles Health and UC San Diego, tested Balance on a muscle cell and found that it increased mitochondrial function and ATP production. So what that means, for those of you that don't know, is that it helps the body with general aches and pains that come with aging. It helps the body heal itself. And it provides, when you increase the mitochondrial function and ATP production, you're providing your body with more sustainable energy throughout your day. So that was really great. React, our allergy formula. When you're having a heightened histamine response, you would want to downregulate. And that's exactly what he said happened. And likewise with Calm, if you have a heightened stress response, you would want to downregulate that as well. And it did. So we are really, we're really passionate about the research and about having that transparency and building trust. I mean, we're just two real people that are trying to make a difference in the world, offering people complementary and alternative forms of medicine.
Yeah, I absolutely love that, and love the fact that you're making those critical investments to prove the efficacy of the actual product with good scientific base behind it. So kudos to you guys for doing that. It's so important. But I'm sure you've probably heard a lot of stories, and I know FDA says because there's no clinical trials effectively, you haven't gone through the years and expenses of what modern medicine goes through, and stops things from getting to the market and creates them to be massively expensive for the whole. You can see I'm a little jaded on some of those things, but the fact of the matter is, I'm sure you've heard a lot of great personal stories, which you're not always allowed to tell because of claims and those types of things on websites. So can you talk a little bit about that and what you're hearing clinically from just customers?
Before Wendy tells you the stories, I want to say one thing about the FDA. I did some research, and there's really not a percentage of efficacy that's required in order to be FDA approved.
Do tell.
So how effective is the approval? It's just, to me, a money scam. Like, here, pay millions of dollars and maybe we'll approve you, but we don't really have consistent basis for which approval is based on.
Isn't that amazing? It's just incredible.
And like I said, several of our formulas have gone up to FDA approval, and Resilience, which is the antiviral formula that saved my life, is one of those. And then they rolled out the vaccine. So why would it have even made sense to pay millions more to keep continuing on that process?
Well, because you also don't spend billions of dollars in lobbying.
That's right. That's right. So I have, I'm not against a standard. I just don't know that the standard is worthy right now. That's all.
Right. No, I hear you, and you're not alone in that thought. I've heard that over and over again, and unfortunately, getting through those processes doesn't mean that it's necessarily the best thing or safe for consumers to be using. for long-term health. So that's why, it's interesting to hear the stories of how it's impacting people's lives.
I think that's one of our most favorite parts of being the founders of this company, because when we hear how our products are literally changing the lives of people, that's just what we love to hear. Lisa spoke about calm. I just want to also show everyone that this is actually what our products look like. It comes in what's called a Boston round bottle. And when you open up the top, it's as simple as one drop. So one drop comes out at a time. And this 15 milliliter bottle holds over 300 drops. So even though it's small, there's a 5-month supply in our largest size bottle.
Wow.
And this,
If you're taking 2 drops a day.
if you're
Wow.
taking 2 times a day. Now, the Calm is really used for a gamut of things. And it can be used for someone that is just dealing with daily stress and just wants to feel a little more calm. But what it really does is it makes you dialed in and more focused. And so when we were thinking of names for all of our products, we went back and forth. Should it be calm? Should it be focus? But really, at the end of the day, when people think about reducing stress, they think about being calm. It works in such a way where it brings the autonomic nervous system back into balance. So it could be something as simple as just taking a drop and feeling a little more relaxed and calm and able to deal with daily stressors, all the way through helping individuals that are on the spectrum, as well as individuals that have ADD and ADHD. And we have individuals that have, you know, gone off of their ADD and ADHD medication, and I'll say it, like Adderall, which so many people take. Even collegiate students are taking it, not because they have ADD and ADHD, but because it helps them get dialed in. So why not take something that is all natural, drug-free, and non-toxic? But the best story is we have, without getting into the belaboring it, when you hear how these drops change the lives of a family whose children or whose child is on the spectrum, and that drop just enables that family to have a little more calm, a little more peace in their home. You know, those type of things affect everyone in the household. And that's what the code kit was really meant for. It was the modern medicine cabinet for the entire household. So if everyone is just taking a drop of calm, including the dog, including the cat, really, it actually helps everyone just feel a little more grounded. And the line that this one young girl said to her parents or her mother, she said, "We're just getting along so much better now."
Wow.
And it's so simple, yet it means everything. Everything. Our other formulas like React. React is our allergy formula. It's probably our second best formula as far as what people gravitate towards. Allergies are so rampant these days. And so our allergy formula works on chemical, seasonal, environmental allergies. And so instead of going to the shelves and getting something like Claritin or Zyrtec or even Sudafed, it actually is the safest way to put your body back into balance so that you are reducing that histamine response in
That
your
stuff
body.
makes me crazy, by the way. I had to go off of it because it would have such I would become like Jekyll and Hyde.
That's right.
Take that
There's
stuff.
your side effects,
And I was
right?
like, listen, I'd rather suffer with allergies than deal with Jekyll and Hyde syndrome.
That's right. I mean, it
My
can make
wife would be like,
people,
who are you?
exactly. It can make people jittery, and to other people, it can make them completely sleepy. So that's a great formula. I do also want to mention Breathe, because Breathe is another over-the-counter product where people are taking it for mucus and stuffy nose, for cold and flu, where you have congestion in your chest, or even for anything to do with asthma or COPD. This is a great way to reduce all of those symptoms of all of those things that I just said. And the other one that I'd love to talk about is Slim. Slim is our metabolic formula. And the craze right now is, people losing weight with things like Ozempic. And those drugs are so dangerous. And so imagine that you can take something that literally helps you stop having any cravings or desires for certain foods, which lead to overeating, or even the craving for overeating, which leads to, gaining weight. This is a fabulous formula, and it works with your metabolic system. So these are just three.
And by the way, they probably work because, like, I'm a stress eater. If I got a lot of stress, so if you can control the stress, you can also control the overeating.
Well, and so it's very interesting that you said that, Brian, because what we've done with many of the formulas is we've paired them into duos. And so we have the cold and flu duo, and the allergy duo, and the healthy mind duo. The healthy mind duo is taking calm during the day and dream at night. So dream is the sleep formula. But what works really well with the Slim is also the calm, because if you are not stressed out and your nerves are not heightened, people that typically overeat when they are stressed out, if they take both of these formulas together, they work hand in hand. So we've really been seeing and hearing all of these stories and testimonials and learning with every month and with every testimonial. I heard a saying, you can't have a test without a testimonial. And that's really what a testimonial is.
Mhm.
So in order for people to really have and be able to talk about their experiences, they have to try it. So why not try something that's safe?
I mean, I think that all makes sense. That's pretty amazing. And you both are being featured in an upcoming documentary. Am I right about that? About women's health and biohacking?
Yes.
Tell
It's
me a
called-
little bit about that. That's exciting.
It's very exciting. It's called Shield. And
Now
it
it's
is
like S
Like she healed.
A L, so it's like healed.
She
Shield.
Healed is
I love
actually how they're saying it. Shield or She Healed. And it's a documentary about women's health optimization. The producers are Anthony and Teresa Lally. And there are about 100 different professionals and different companies that have specialities that talk about a woman's lifespan from birth all the way through, years on in age. And we are honored to be part of this documentary. It comes out in May. It's being premiered at the Cannes Film Festival. So we're very excited also to be going to France because, we're a little fancy. So we like to do these things.
The Code
Yeah.
Girls are fancy.
Yeah.
The truth.
I love it.
Yep.
Well, I have to tell my wife about that because she's really been following what I've been doing on this side, and she just said to me like a couple of weeks ago, she's like, "Do you know any good resources for like women's health? Because my issues are a little different than yours." I'm like, "Yeah, they are." I said, "But I don't know. I'll have to do some research into that." So that's amazing. That's great.
Yes. We've been featured in a few different documentaries, and actually we're recording this upcoming year in a couple as well. So I think what people are going to see more and more are companies like ours that are thinking out of the box and that are a healthy alternative, and just other modalities or even devices that are explaining to the general public that there really is another way to look at things other than the traditional allopathic things that people just think it's the only answer. And it's not that we don't believe in medicine, but there's a time and a place for it. And like we always say, if you break your arm, our code drop is not going to be able to fix it. You need to go to the hospital, you need to get a cast, you need to have it done.
Right.
But instead of taking the medication that they're going to give you to stay out of pain, take the code drop for that.
Well, I just, I've always been of this belief that our amazing creator has given us what we need in the land and in our bodies to do the right things, right? We just got to get it right. And over the years, we've just shoved so much stuff in our body, synthetic kind of stuff and chemicals. And it's just, to me, it's like I really started paying attention to what I was putting in my body and how it was reacting. So I would take something, I would stop taking it, I would see, and I literally started journaling and I really started realizing that, well, I had a lot of side effects going on from prescription meds. So then I started saying, okay, what do I need to do to sort of regulate this? But this sort of opens up a whole different chapter, the way that this is working. I mean, I love it. And so for our listeners who are intrigued, as I am, with what we've just heard, whether it's dealing with stress, sleep issues, pain, or just interested in exploring more of these bioenergetic approaches, what's your advice of how, myself or our listeners can get started here?
Our website is www.codehealthshop.com. Our social handles are at Code Health Shop. We are on YouTube. We have a YouTube. It's Code Health. And same thing on LinkedIn. It's also Code Health.
Something else that we just started, I apologize, Lisa. Something else that we just started is an exceptional email campaign. And the email campaign is very, very informative. And so we welcome everyone to go onto the website and join our newsletter, because not only do we provide the information about code and the products in our newsletter, but on our website, Dr. Lisa actually writes blogs, and there are blogs that are very informational about things beyond the scope of just code drops. We also contribute to articles as well, and all of those articles and publications are on our website also.
That's awesome. And Dr. Lisa and Wendy, final thoughts. What do you most want people to take away from this conversation?
Well, I think for me, it's always two things. My first piece of advice is make small incremental changes to be better today than you were yesterday. And there are alternatives. So when you look for them, you find them. But if you're not looking for them, you won't find them. So keep looking.
I love that. Wendy, how about you?
For us, our mission is to really empower people as to understand the importance of what they put on and in their body. And so, with that being said, just think about that our bodies are really meant to heal themselves. And so, if you're putting things that are natural on your body and in your body, you're just enabling and you're helping your body to function at its ultimate that it should, right? At the best that it possibly can. If you put things on and in your body that are toxic, then you're making your body work harder to first rid of all of those toxins to then make it work properly.
And again, love that also, because it's something that I have a fundamental belief in. It's really what started my journey into this. But because I'm a reg tech, compliance tech kind of guy, I said, how do I apply what I know to this industry that's important to help it become more transparent, to be safer, and to help companies like yours really advance the mission. So Dr. Lisa Piper, Wendy Cohen-Osborne, thank you so much for joining us on Qredible Live. This has been an absolutely fascinating conversation about the future of wellness, about something entirely different than what we're really used to hearing, but is important. So it's really, I love the research you're doing, and the data and the transparency are the foundation of your mission and your vision. and making people better and healthier is your vision and mission. So thank you for the work you're doing collectively. I know it's not easy to be entrepreneurs, and I know it's not easy to educate people on something that's entirely different than what they're used to hearing. So keep doing what you're doing, and I'm going to get my wife onto that documentary, and I don't know, who knows, maybe then she'll say, well, why don't we go to France? And she's fancy too.
There you go.
So thank you again for joining us. And Faith, what do we have coming up as we look forward to season 4?
Yeah, so season 4 starts March 13th. So keep a lookout for that. We'll post leading up to it. We already have a few guests booked, so that's really exciting.
Awesome. This has been amazing. Thank you again. I hope you guys have a great weekend, and we want to have you back on Qredible Live. So Faith, make sure we make that happen so we can follow your great progress. We'll talk after Paris.
There you go. It's a date.
All right, that sounds great. Thanks so much.